Okay, I think we'll get started. So, welcome everybody to this webinar today. This is a webinar on our annual report findings linked particularly to equality, diversity and inclusion. My name's Jamie. I'm Head of Education at the HCPC, and I'm just going to be taking us through the first few slides. Housekeeping. So we'll be running a presentation and then we have a Q&A discussion section to kind of have a bit of a conversation about this if we would like to. We've kind of automatically muted everybody's mics and cameras are off too, but we can unmute you and put your camera on if you want to ask a question or raise any points verbally. You can also use the chat box in the Q&A box, so please feel free to do that through the presentation today, and we'll come back to, like I said, those questions at the end. So our agenda, I'm going to provide a quick summary of education, the HCPC Education's function. I'll then be handing over to my colleague Saranjit to focus on our equality, diversity and inclusion part, the findings that we have to present to you. We've got that Q&A discussion that I've mentioned, and then we have some reading materials too to present at the end. The education function at the HCPC, our role is to set and maintain education standards, and those standards are output focused to ensure those that complete approved programs meet our requirements for registration. That's a statutory function at the HCPC, and we make decisions about the initial approval of education providers and programs, and then we monitor data, intelligence, and information on an ongoing basis. Education providers engage with us at fixed points to reflect on the ongoing quality of their provision. And crucially here, on completion of approved programs, individuals can apply to the register and are fit to practice at that point of registration. Our quality assurance model, the way it functions really, we are flexible, intelligent and data-led in our quality assurance of institutions and programs. We have four key pillars that underpin our work in this area. So we undertake assessments at the institution level and at the program level, and we focus on those areas kind of differently and at the right times. We're flexible in our approach, so we're not one size fits all. We consider what's happening before we jump to solutions and kind of our quality assurance activities. So we apply our model flexibly depending on the situation. We consider data and intelligence. So we have data sources that we review, and we also listen to intelligence of people and seek out intelligence too. And linked in with that, we have a four nations and regional approach. So members of my team, people like Saranjit and other people who are on the call today from the HCPC, are experts in their kind of regional national patches, and link in with key contacts in the regions and nations too, so that we really understand what's happening, and that we can help others to understand what our focus needs to be too. So what are we here to do today? So we produce an annual report. It covers the 2021-22 and 22-23 academic years. It sets out a state of the nation for the education and training in the 15 professions that we regulate. And what we try to do is focus on key areas linked to quality of education within the professions that we regulate and key challenges faced by the sector. And the intention of this report and these sessions that we're running, and I'm sure that many of you have been to some of the other sessions that we're running too, is to provide insight to our stakeholders and what's happening. Now, we don't think that we're going to be presenting anything, brand new and shiny to you today. I expect what you'll see is a lot of what you already know reflected back to you. But hopefully it's useful for you to know that the regulator is across the kind of key points. And we're really keen to hear from you as well. So, we want to enable conversations about the areas that we're talking about. So today, particularly EDI, think about what needs to change and how education providers can approach specific areas. Now, we think the audience of this session is primarily education providers, hopefully those at education providers that are responsible for EDI. But we appreciate that there are others in this session today too. And so we want to try and make sure that the messages are useful for all. But when we've designed this, we certainly have focused on education providers as our key primary stakeholder. How do we produce this report? So it's evidence-based, factual report. It's based on our assessments over those 2 academic years, which I've noted. And our quality assurance model enables us to understand what education providers are doing to meet our standards, and what they're doing when they continue to develop. Our previous model didn't really allow us to do that. That focused on problems more than anything. But what our current model enables us to do through our reporting is to see how education providers have dealt with meeting our standards, how they deal with challenges in the sector, and we can then reflect that back and reflect back kind of key findings back to the sector, which is what we're doing today and what we've done through the report itself. So I told you that would be fairly brief, and those of you that know me, that is fairly brief. Now I'm going to hand over to my colleague Saranjit, who's going to take us through the substantive piece of this. So over to you, Saranjit.
Thank you, Jamie. Afternoon to you all. Right, quality, diversity and inclusion. It's a very key and important area. And our standards are set at institution level, and we assess these across the provision. And obviously quality, diversity and inclusion is included in that. We therefore expect all education providers to have appropriate policies in place and for these to be considered across the professions they deliver. Jamie, could you go to the next slide, please? Thank you. As the regulator, it is our role to protect the public by ensuring our registrants are fit to practice and our standards make sure learners are prepared for safe and effective practice. We expect our standards to be met at threshold level. However, we must acknowledge we are not experts in this area. We can set threshold expectations on how education providers and registrants can meet EDI, but it is the education provider's responsibility to decide how they address issues in this area. There are standards relating to EDI, such as sets 2.7 and 3.14. The purpose of these are to ensure education providers have equality and diversity policies in place and that these policies are monitored in relation to learners. We recognise the importance of EDI, and in September 2023, we introduced our revised standards of proficiency, where we significantly expanded the role of EDI with an emphasis on making sure that practice was inclusive for all service users. This was because we considered it was important for education providers to have strong EDI policies to support learners and underpin the delivery of the SOPs. Jamie, could you go to the next slide, please? Thank you. Key findings. Education providers have been leaders in the EDI for some time, and it has been an area of focus, which is evident from the report. The widening participation agenda has been in place for 20 years, and data and information shows the positive impact this initiative has had. There is clear evidence that there has been an increase in the number of learners progressing to higher education from 80.6% to 83.1% in 2021-2022. It's good to see institution-level strategies, high-level commitments relating to EDI are in place. These strategies aim to ensure education providers are inclusive and fair in their activities and tend to focus on areas such as learner recruitment and admissions, experience, progression, attainment and employability. Having a proactive approach to these strategies helps to achieve a successful outcome, which includes defining intentions and how these will be delivered. Once delivered, it is important to measure the success and build on it. Jamie, could you go to the next slide, please? Thank you. We are focused on EDI with our requirements of providers and revised SOPs. We recognise education providers are aware of their legal responsibilities in this area and therefore have institution-level strategies relating to EDI. We see identifying problems as a strength of good quality assurance. This demonstrates education providers have appropriate processes to monitor data relating to EDI and are able to identify issues and gaps and address them. We collect a range of data relating to this area and produce fact sheets based on the data we have recorded on the register. These fact sheets are available to access on our website. The data we gather in relation to EDI provides us with an overview across all our professions. This includes data on disabilities, gender and ethnicity, to name a few. It helps to provide an understanding of the current picture across the professions. For example, across all the professions, the average age is 42 and 8% of registrants have disclosed they have a disability. Women represented a significant proportion of our register at 76%, but there were some professions such as paramedics who had a much higher representation of men at 59%. So it's interesting data and it is worth looking at. So if anybody ever has time to actually go into that level of detail, please do access it via the website. Jamie, could you go to the next slide, please? Thank you. Data is important to understand this area, and it helps with identifying the challenges and disparity in admissions and attainment. Data is especially useful for education providers as it helps with them with informing actions and future developments. There is a focus on staff to enable good practice in this area. To ensure staff are equipped to do this, they are provided with support in the form of mandatory EDI training. Some education providers also have dedicated job roles for EDI, as well as committees and boards to support the delivery of EDI initiatives. This normally involves people at senior levels, learners, and service users and carers. This approach tends to provide education providers with varied feedback, which can help with identifying the gaps and challenges with EDI and responding to them. It also helps with developing future strategies. Jamie, could you go to the next slide, please? Thank you. Alongside the internal structures, education providers are encouraged to use external frameworks as well, which is considered good practice. Using external frameworks such as the Athena Swan Charter and the Race Equality Charter assist in developing new ideas in higher education and support the development of EDI initiatives further. The Workforce Training and Education Director of NHS England The Workforce Training and Education Director of NHS England also support education providers and fund initiatives to develop and improve this area, such as the Office for Students' ambition to reduce the awarding gaps for Black, Asian and ethnic minority learners. Jamie, could we get to the next slide, please? EDI can be challenging, however, we must not look at these challenges from a negative perspective. In the performance review portfolio, when we receive reflections from education providers on the challenges education providers have experienced and the work they have undertaken to understand the problem, we consider this as good performance, as it shows us you have identified an issue and addressed it. Many education providers have experienced some challenges with the attainment gap for particular groups of learners, where we have seen a range of interventions based on the data that we've obtained. Some professions have a more traditional profile, and therefore education providers advertise programs with specific groups in mind. This allows them to reach a broader audience, which helps with widening the professional profile for some professions. Alongside attainment gaps, education providers have also focused on addressing systemic racism in response to the Black Lives Matter and anti-racism movements. One of the main developments in this area has been decolonising the curricula. Can we go to the next slide, Jamie? Thank you. We recognise the challenges within this area will continue and will change according to societal factors. However, we must acknowledge there are a range of initiatives and external bodies providing education providers with support to develop this area further and address the challenges. Through the performance review portfolio, we encourage education providers to continue to reflect on the challenges experienced in this area and the work undertaken to address them. We would also expect education providers to consider providing reflections on frameworks they have adopted, such as the Office for Students' Equality of Opportunity Risk Register and the Council of Deans of Health report on anti-racism in allied health profession education. We are currently undertaking some research to develop and define our understanding of what normal and best practice looks like. This work will include engagement with our stakeholders. We're also using the findings from the annual report for this research. When this piece of work has been completed, the aim is to provide education providers with consistent advice and to also help us make consistent judgments against our standards in this area. Lastly, you may already be aware the standards of education and training are currently being reviewed and are in the pre-consultation phase. All standards are being considered in this review, and the timescale for implementing the changes will depend on the significance of the changes we make. We may therefore see some further changes.
Has the range gone for everybody, or was that just me? Sagita is
It appears that we've lost Saranjit
Ah.
sound.
No worries. She was having technical difficulties just before the presentation. She's got through 99% of her presentation there. So I'll just pick up on the point about the revised standards of education and training. As Ranjit was just saying, we are currently reviewing those, and we'll be considering the research that she mentioned to develop the standards linked with EDI, and also looking a bit more broadly just to see whether which standards are kind of linked in with EDI, and how we consider EDI as a thread through our standards of education and training. We're in the very early stages of that, both of those pieces of work there at the moment. But like Saranjit was saying, we'll be able to we will engage stakeholders on both of those pieces of work to make sure that we are kind of reflecting back best practice and normal practice there. I will move us on. So here's this list of further reading materials. Like I posted in the chat earlier, we will share this, share these slides with you and share the recording from the session. We'll snip out the Q&A because we want to make sure that anything that's kind of shared there isn't kind of available forever online. We want that to kind of be a bit more of a private session for us who are in the room. But certainly the reading materials are there. Hopefully some useful points there that might cover some of the points that were in the chat. And I would recommend, actually, just going back to that slide, the annual report does have a number of pages on EDI. It's got pages on EDI which are linked in with our approval process, so initial approval, and also the monitoring exercises that we undertake. And that goes into, essentially, it goes into more detail of the points that we've raised and talked about today. So hopefully, again, that should give you some more information if you're interested to read that in a bit more detail. Future webinars. So we are coming towards the end of our program of engagement on our annual report. So we have a webinar next week about service user and carer involvement and the sustainability of that involvement. The links that you'll be able to click when we send the slides to you will have the materials from previous sessions too. So we'll have the recordings and they'll have the slides available there too. So we want those to be kind of permanent resources that we can refer people to. We've got a couple more if you are interested in service users and care involvement or embedding our standards of proficiency, then please do. And here is a list of all of the people in my team. So I talked about we have a regional approach, and we have people that are experts in particular regions. So if you're from an education provider, please get in touch with the person who is listed on the slide there. And we have our main mailbox there as well, which is just education@hcpc-uk.org. That contact information is available on our website too. So if you don't get the chance to kind of note it down now, or you don't want to wait till the slides to come across, if you have something burning to talk to us about, then please get in touch with one of our colleagues. And like I say, that stuff can all be found. The contact details can be found online too. Okay. I'm going to close it off there then. Thank you very much for a really interesting and engaging session. I hope you found that useful. I certainly did. And I think just to kind of reflect back on one of the points of Saranjit's last slide really is that we recognise that this work is never done. And we appreciate we're in kind of a certain part on a journey to improving EDI through education and through our kind of regulatory standards too. And so you can take it from me that we are committed to doing that, and we'll move forward with that, and we will engage with the sector to make sure that we are listening to voices and you're able to shape the regulatory requirements and approach linked in with this area. So that just remains for me to say thank you very much for the session, and I'm sure we will see you all again soon. Thank you, everyone.